And other specific markers or panels you consider non-negotiable when building a treatment plan for a person?
Yeah, well, I would say hormones. I need the basics, so CBC, CMP. Lipids, again, I'm a fan of high cholesterol. I'm very forthright about that. Cholesterol does everything for your system. It builds all your sex hormones. 25% of the weight of your brain is cholesterol, all your cells, vitamin D. So I check it anyway. And then when it comes to the actual non-negotiables, I love gut health. I think food sensitivity testing, just even if it's, some people love it, some people hate it, but if you're sitting there and you're consuming the same thing every single day and it shows up, variation in how your food works. And again, like we talked about, your food, your digestive tract is the second brain in your body. So if you sit there and you can continually pollute that, you get a leaky gut, your immune system goes off, and now you have a consistent source of inflammation, which takes away from your nutritional goodness bank, like we talked about earlier. You have that embezzling from it. So, all we do with the stressors is we try to find every single that's in your system, embezzling the actual ATP, the energy from your system, and I attack it that way. We do get in depth with things like natural killer cells, like really in-depth immune testing. Neurotransmitters, I think, is fascinating. Whenever somebody comes in who has any type of mental blocks or anxiety or depression, we hit those hard. The nutrition, B12, all the Bs, we do the vitamin Ds, all the fat-soluble vitamins. It's funny, Access has granted me, Access is the lab, the most in-depth lab test in the world currently. We have 750 markers on it, which seems like overkill. But if you find that one marker, whether it's chronic EBV or Lyme or Candida or something that's weird that nobody ever checks, you just now solved chronic fatigue syndrome, fibromyalgia, even long COVID. I mean, because you're gonna sit there and see you have two viruses in your system, EBV, which pretty much everybody has, a reactivated form of that. The amount of nutrition that you have to pull away to create all these IgG, IgMs towards it, it's mind blowing. So again, like with me, I do have probably the most extensive and expensive lab testing in the world. But then again, my results speak for themselves. Even though it's in depth, we are treating everything from erectile dysfunction to cancer to Parkinson's disease with phenomenal success.